Hello everyone, welcome to FMT Guru. Today's topic is arsenic poison and the mnemonic is Bonaparte triple R. Arsenic is very commonly asked in exam. You can remember most of the information related to arsenic with the help of very famous mnemonic Bonaparte RRR. Arsenic, it is a ideal homicidal agent. It is a colorless, tasteless, odorless compound. It is known as king of all poisons. The Napoleon Bonaparte, he was killed by arsenic poisoning. He died due to stomach cancer. That's why I prepared a mnemonic for you, Bonaparte triple R. So there are many MCQs, at least 15 MCQs in this mnemonic. Just concentrate all of you, Bonaparte RRR. The first question asked in exam, arsenic, what is the most common source? The most common source of arsenic, your answer should be water. It is water is the most common source. Lead poison, it is air. Arsenic, it is water. What are the common sources? Smelting, microelectronic industries, pesticide, herbicide, deep water well, coal factories, folk remedies, preservatives, fruit sprays. All these are the common sources of arsenic poison. The most common source is water related. Let's discuss about the important points about arsenic poison. The king of all poison, he is Napoleon Bonaparte. He is Bonaparte. He died due to stomach cancer, and one theory of his death is arsenic poison. B for black foot disease. Black foot disease. Black foot disease, it is a peripheral vascular disease caused by arsenic. Arsenic causes vasospasm and the vasculitis leads to black foot disease. It is asked in one of the exam, in NEET PG exam and in INI-CET exam, black foot disease. O for oxide, arsenic trioxide, which is the most common form, which is known as Sankhya, which is known as Somalkar, white arsenic. All is our MCQ, arsenic trioxide. So the fatal dose, again it is asked in exam, 120 to 200 milligram in adults. In children, it is 2 milligram per kg body weight. And one more O for oxide, O for garlic odor. Garlic odor, again it is commonly asked in exam. Garlic odor is also seen in phosphorus poison. Okay, so B for black foot disease, O for oxide. Then neoplastic, it causes neoplasia, basically skin cancer, lung cancer and a bladder cancer. It deposits in the nail and hair, that is a well known fact. A for it causes anemia. It is a well-known aphrodisiac. It causes alopecia. It causes Addison's-like disease. Aphrodisiac. It is used in abortion stick. It is also causes apoptosis. Arsenic-induced apoptosis. That is also asked in exam. Okay. Then P for peripheral neuropathy. The neuropathy, remember, in arsenic, it is a mixed neuropathy and it commonly involves distal muscles. Okay, and also arsenic inhibits pyruvate dehydrogenase enzyme. P for pyruvate dehydrogenase enzyme, that is inhibited by arsenic. And A for, that is Aldrich-Mees line. Aldrich-Mees line is also very commonly asked in exam. They are transverse lines seen over the nails. So look at this, all of you. There are 5 important findings in arsenic poison that can be asked as an image based question. So the picture number 1, the topmost picture, that is nothing but black foot disease. Then one picture you can see some green pigment is there. that is Scheele's green, that is copper arsenite. And you can see a white color compound which is white arsenic, that is nothing but your arsenic trioxide Somalkar Sankhya. Paris green, very well known insecticide, that is copper acetoarsenite. And the last picture you can see, that is the white transverse line, that is known as Meese line, Aldrich Meese line. Okay, so let's discuss some more part of the mnemonic. Bonaparte, R. So R for, what is R for? R for, it leads to rigor mortis lost languor and it retards putrefaction. T for, that is teratogen. E for, it causes gastroenteritis, it causes cholera like picture, cholera resembling disease, arsenic. Okay, and it causes endocardial hemorrhages. So, and R for, triple R is there, all the three are very commonly asked MCQ. R for raindrop pigmentation, okay, it resembles like measles rash. R for red velvety stomach. Stomach, because of the hemorrhagic gastroenteritis, it becomes red velvety stomach. And R for rinse test, not only rinse test, Marsh test, Gutsy test. All these tests are outdated tests, they are not used nowadays. Then fatal dosage, already we discussed, and the most fatal is arsenic gas, arsine gas, 25 to 30 ppm, so that in 30 minutes it causes death. And in adults, 120 to 200 milligram of arsenic trioxide in 1 to 2 days. Then diagnosis. Diagnosis is made with the help of neutron activation analysis. Normal concentration of arsenic in the hair 2 ppm and in urine it is less than 0.03 milligram per liter. When it is more, then it suggests probably an arsenic poison. Then the last part, treatment part. Treatment part, one of the common drug used is British anti-Lewisite. British anti-Lewisite, it is given intramuscularly. It is never given intravenously because it causes fat embolism. It contains peanut oil. You can give penicillamine whenever the patient is allergic to ball. Also you can give DMSA or DMPA. All these are the chelating agents. Okay, chelating agents. So then some more pictures, all of you. There are again 5-6 pictures are there. We'll start from the topmost one, that is the left side. You can see there is a classical finding. Okay, this is a classical hyperpigmentation. You can see this is known as raindrop pigmentation. And the second picture you can see there is a red color, red velvety stomach because of hemorrhagic gastroenteritis, red velvety stomach. Then garlic powder, just to help you to remember in exam, garlic powder seen in phosphorus poison also. And there is a one more important finding, erythromelalgia. Erythromelalgia. And the arsenic can be found in dead bodies even after many years. Okay, it retards putrefaction. And the agent here you can see, this is the ball. So ball, remember, this is the chemical nature of the ball. So ball contains sulfhydryl radical. Ball is contraindicated in iron poison and cadmium poison. So please remember, so ball is contraindicated in iron poison and cadmium poison. Contraindicated. So this is contraindicated in case of iron and cadmium poison. So that's it about the mnemonic Bonaparte RRR. Happy reading. Thank you. Hello everyone. Welcome to FMT Guru short simplified 10-minute series. We are going to discuss lead poisoning in 10 minutes. Lead poisoning is very commonly asked MCQ in your INI-CET exam, NEET PG exam, FMGE exam and also in UG examination. It can be asked as 5 marks question in UG exams. Lead poisoning, it is known as plumbism. It can be asked in exam. Plumbism, Saturnism, painter's colic, or minus disease. You can remember the important clinical features in case of lead poisoning with the help of mnemonic Bahubali. Okay. Let's discuss about what are the sources of lead poisoning. The sources are basically lead acid batteries, Duracell battery. So acid batteries, they contain lead. Bullet dust that contain lead. Air pollution. Remember, arsenic, it is water related. Lead poisoning, it is actually air pollution related. Then it can be paints which contain lead chromate. Lead chromate, it can be asked in exam. Lead diacetate, which is known as sugar of lead, the fatal dosage 20 gram. Or lead sulfide. Lead sulfide is the least toxic compound of lead. Lead tetroxide, it is also asked in exam, which is there in Sindoor, Vermilion. Tetraethyl lead, which is fatal dosage is around 100 milligram per kg body weight, which is used as anti-knock agent in petrol. Lead carbonate, the common source, the fatal dosage is 40 gram. Lead poisoning is also known as painter's colic. It is also known as Saturnism. You can remember the mnemonic Bahubali. So B for, what is B for? So the first picture on the left side, you can see the topmost, a patient suffering from lead poisoning. You can see clearly visible blue black line. So this is known as Burtonian line, also known as Burton's line. Okay, this is the Burton's line. B for Burtonian line, Burton's line, which is seen in 50 to 70% of the cases. But remember, it is not specific. It can be seen in copper poison, iron poison, mercury poison, silver poison. It is first explained by Henry Burton in 1840. So B for Burtonian line. And the second image you can see there, there is a microcytic hypochromic anemia. Okay, so this is the differential diagnosis of iron deficiency anemia. You can see there is an anemia. Because of anemia, there will be facial pallor. So you can see here anemia and the facial pallor. If they ask you an exam, earliest finding in case of lead poisoning, your answer should be facial pallor. That is because of either anemia or because of vasospasm. Why there is anemia? Because of inhibition of heme synthesis. Basically, there are two enzymes which are inhibited. One is ALA dehydratase and the second one is ferrochelatase. Then the third picture you can see here, H for it is actually headache and encephalopathy. Headache and encephalopathy, which is a common finding in children. In children, encephalopathy is a common complication of lead poisoning, which is commonly associated with tetraethyl lead. Lead poisoning also associated with hallucinations, hypertension and hyperesthesia, and there is a motor neuropathy in case of lead poisoning. It is also asked in exam, motor neuropathy, and you can see a child suffering from the lead encephalopathy. The treatment will be ball and calcium EDTA combination. Then U for, that is increase uroporphyrins. Like example, coproporphyrins, uroporphyrins, all these porphyrins are increasers, and also there is increased levels of delta amino levulinic acid. And one more B comes here, the mnemonic, the B for basophilic stippling. Basophilic stippling. Why there is a basophilic stippling? All of you, it is because of inhibition of 5' nucleotidase enzyme, which causes actually RNA aggregation that leads to basophilic stippling. So BAHUB, that is Burtonian line, anemia, encephalopathy and headache, uroporphyrin increased, basophilic stippling. Next, other part. Now look at this. A for Bahubali. A for you can see there is a abortion. So abortion because of the compound known as lead oleate. So abortion, atrophy of optic nerve, arthralgia, abdominal pain and constipation. The most common clinical feature, constipation, not diarrhea, and the abdominal pain. And that is one more, that is lead palsy. L for lead palsy and lead bands. You can see there is a wrist drop. There is a wrist drop is there here. It is because of the neuropathy. Neuropathy caused by the lead. And also you can see an X-ray. There are lead bands are there. Lead bands. Lead bands also you can see in the children. So you can see the X-ray of a child of less than 18-year-old, and there are lead bands are there, probably due to lead. Then one more, that is I for last word, impotency, infertility and insomnia, irritability. All these are the clinical features. They are seen in lead poison. Earliest manifestation, facial pallor. Most common finding, constipation, abdominal colicky pain. Then diagnosis and treatment. So diagnosis by blood level of the, that is lead, that is more than 45 microgram per deciliter. Then you should start the chelation therapy. Basically you should start calcium EDTA around 1000 milligram per meter square, which is given IV, and BAL is also given, that is intramuscularly, that is given in case of encephalopathy. If the mild patient or asymptomatic patient, then you can give oral DMSA or oral penicillamine. Then what are the important MLI and cause of death? Cause of death, all of you, it is encephalopathy or liver failure, renal failure, or the intercurrent infection or malnutrition. Medical legal importance, as we discussed already, it is used in criminal abortion. It can be an occupational disease. The poisoning can be seen in souvenir bullet. It can be a cattle poison, and then it also leads to impotency because of low sperm count. So this is about the important clinical feature, management, diagnosis of the lead poisoning, Bahubali. So thank you. Happy reading. Hello everyone. Welcome to FMT Guru. Welcome to SS series, short simplified 10-minute series. We are going to discuss mercury poisoning in 10 minutes. Mercury poisoning is very commonly asked question in NEET PG exam, your INI-CET exam and FMGE exam. And mercury poison, it is a heavy metal. This mercury poisoning is also known as hydrargyrism, acrodynia. So it is known as acrodynia. It is asked in NEET PG exam. Acrodynia. Acro means periphery. Dynia means pain. The pain at the periphery, that is acrodynia. That is caused by mercury. Mercury poison, especially, it is also known as Pink's disease. Pink's disease. Again, the question asked in exam. Minimata disease. It is also known as Hunter-Russell syndrome. Okay, and it is also known as Mad Hatter's disease. Very interesting one. Mad Hatter's disease. Mad Hatter is a character. The Mad Hatter is a character in Alice's Adventures in Wonderland, a novel written by Lewis Carroll in 1865. He showed some signs of mercurial erethism. Okay, mercury poison is also known as hydrargyrism, acrodynia, Pink's disease, Minimata disease, Hunter-Russell syndrome, Mad Hatter's disease. All are correct. And in the picture you can see there are two important pictures. One, there is a red color compound. You can see some red color compound which resemble like blood. Okay, What is this known as? Mercuric sulfide. It is asked in exam. And mercury thiocyanate, it is one of the the firework that is used in Deepavali or Diwali. Okay, so and with this now we'll start mercury poison. You can remember important clinical features and MCQ with the help of a mnemonic known as M3 battle. Battle. Let's see about what are the sources of mercury poison. It can be either mercury chloride. Mercury chloride is also known as corrosive sublimate, which was used in syphilis. Entrance point. What is the fatal dosage? 1 to 4 gram. Fatal period 3 to 5 days. It can be mercurous chloride. Mercurous chloride, which is a component of calomel lotion, which was used as a fungicidal agent. It is also used in abortion, criminal abortion. Mercuric thiocyanate, that is present in Diwali winding snake. Mercury sulfide red color, sindoor. Batteries that contain mercuric oxide. And very, very poisonous, if they ask you in exam, ethyl mercury or methyl mercury, they are nothing but organic salts. They are very poisonous. Elementary mercury is not poisonous because it is not absorbed in GIT. Let's discuss about M3 and battle mnemonic. M3. I am showing a picture of a fish here. Fish, and also there is a picture of an eye, and also we can see there is a extreme degree of tremor. What it is known as M. So whenever picture, that is Minamata disease. M for Minamata disease. Minamata is a disease that happened in Japan. It is because of consumption of industrial wastewater which was containing methyl mercury. It is characterized by neuropathy, ataxia, tremors, cerebral palsy in fetus and seizures. It is also known as dancing cat fever. So this is the 1M. Okay. M, that is 1M is Minamata disease. And the second one, it is about that is Mercuria lentis. There is a deposition of the mercury in the anterior lens capsule, that is known as Mercuria lentis. And remember, there is one important reflex that is known as brown malt reflex. Okay, and extreme degree of tremor. So this here you can see, this is known as concussion mercurialis. Tremors are so intense that they prevent daily activities. So, and one more M is membranous nephritis. So, Minamata disease, Mercuria lentis, membranous nephritis and mercurialis. 3M. Okay, 3M. Then we'll start with the B. What is B for? B for black line over the gums, characterized by blue black line over the gums or salivation. Okay, so and also brown malt reflex. And in the picture you can see, the fifth picture, you can see there is a pink color appearance of the peripheries, especially the feet and the hands, because of the neuropathy. This is known as acrodynia. It is also known as Pink's disease. So A for acrodynia, Pink's disease. Why? Because of catecholamine excess. So mercury inhibit metabolism of catecholamines, that leads to all this pain, pink limbs. It is normally confused, or differential diagnosis is Kawasaki disease. It is asked in exam. Kawasaki disease resembling poison, mercury. Cholera resembling poison, arsenic. Metal fume fever caused by zinc. Okay. Scarlet fever also differential diagnosis. Strawberry tongue is also that is seen in Kawasaki disease, that can be seen in case of acrodynia or Pink's disease also. Okay, so this is about M3BA. Then TT, that is LE, that mnemonic we are going to discuss. So T for, very simple. T for one of the very common symptom is tremors. Tremors, intentional tremors. They are intentional tremors. Tonicity decreases. They are also known as Dan Bury tremors, glass blowers tremors, or Hatter's shake. And what is L for? L for, you know, eye is affected, lens is affected. Lens is affected. Then last for E. E for, that is extreme degree of shyness, delusions and hallucination. That is known as erethism. Anxiety, shyness, depression, loss of confidence, delusions, hallucination, suicidal, melancholia, manic depressive psychosis, all these are the features of erethism that is seen in case of mercury poison. So this is about the mnemonic that is related to mercury M3 battle. Let's discuss about what is the diagnosis and how to treat the mercury poisoning case. Diagnosis again, that is levels of mercury in the blood. Levels of mercury in the blood when it is more than 35 microgram per liter, or in presence of mercury in the hair, urine more than 150 microgram per liter. So then you can conclude mercury poison along with the clinical features. Treatment, as you know all of you, any heavy metal poison, chelation therapy is given. What is the drug of choice? Ball is given along with DMSA. You can give N-acetyl D-pencilamine, that is also known as NAP. Okay, NAP. And one more entrance point here, ball is contraindicated in organic mercury poisoning. So what are the other contraindication of ball? We discussed in previous classes. So ball is contraindicated in, mnemonic is PICO. PICO is a mnemonic. PICO is a mnemonic. So what is P for? P for, that is the peanut allergy. I for iron. C for cadmium. O for organic mercury poison. So I'll just write here peanut allergy, iron poison, cadmium poison, and lastly that is organic mercury. In all this condition it is contraindicated. PICO is the mnemonic. Then medical legal importance. Lastly, so mercury sulfide resemble like blood stain, and it is also used in criminal abortion. There can be an accidental poisoning of mercury. Suicide and homicide is very rare. Accidental poisoning is seen in whenever there is a break of the thermometer in the mouth. So or break of the BP apparatus. So that can lead to accidental mercury poison. So this is about the mercury poison. Mnemonic is M3 battle. Once again I'll repeat all the important feature. M for Minimata disease, mercurial membranous nephritis, concussion mercurialis, and brown black line that is seen, acrodynia. T for tremors, tonicity decreases, lens are affected, and erethism that is seen. Drug of choice is ball and DMSA. So thank you. Happy reading. Hello everyone. Welcome to FMT Guru. We are going to discuss copper poisoning in 5 minutes, and we are going to cover minimum 10 MCQ from that. Okay. And copper poisoning. So there are 3 compounds related to copper. One is the copper acetoarsenate. Copper acetoarsenate is also known as Paris green. It can be MCQ. Scheele's green, which is known as copper arsenite, it can be MCQ. Copper sulfate, which is nothing but blue vitriol, that can be an MCQ. And chronic copper related disease is known as Wilson disease. It is named after American born British neurologist Samuel Alexander Wilson. Let's see about the copper poisoning. What are the features? As we discussed, there are 3 compounds related to copper poisoning. One is copper acetoarsenate, Paris green. Copper arsenide, shield is green. Copper subacetate, that is verdigris. Copper sulfate, that is blue vitriol. Fatal dosage is around 20 gram. Mnemonic is KGF2, K for KF ring. You can see here in the picture on the left side, you can see there is a collection of the green pigment in the descendant membrane of the cornea, that is known as KF ring. That can be seen in Wilson disease, that can be seen in chronic copper poisoning also. This can be an MCQ. Wilson disease, ATP7B gene defect, there is a hepatolenticular degeneration, greenish brown cornea of the lens. So what is G for? G for either it can be granuloma of the lungs, that is because of copper poisoning, that is known as Vineyard-Sprayer lung disease. It can be an MCQ. Or G for, that is green hair, or it can be green line on gums, or it can be J6PD inhibition. Granuloma, that is known as Vineyard-Sprayer lung disease, and it is characterized by interstitial pulmonary fibrosis, histiocytic granuloma. Clinical features are dyspnea, rales and wheezing. It can be MCQ. Lastly, F for fever, F for fatigue. So there can be fatigue due to vomiting and jaundice, fever, that is can be a metal fume fever. There can be hepatic necrosis, hepatotoxicity, myoglobinuria, rhabdomyolysis, hypotension, serious collapse. Then T for one common finding is tremor. Tremor because of accumulation copper in the basal ganglia. Okay, T for tremor. And Wilson disease, W for Wilson disease, and O for osteopenia. O for osteopenia. So once again I'll repeat: 6 MCQ, KF ring, green hair, G6PD inhibition, green line on gums, granuloma of the lungs, fatigue and fever, tremors, Wilson disease and osteopenia. The lastly, the management. Management basically diagnosis. So diagnosis, that is levels of ceruloplasmin that decreases. Levels of ceruloplasmin that decreases, and there will be increased 24-hour urinary copper excretion. And the treatment is dimercaprol 5 to 15 mg per kg body weight 4 hourly intramuscularly until urinary excretion becomes less than 50 microgram per 24 hour. You can use penicillamine, you can use oral zinc, you can use unithiol, you can use calcium EDTA, ammonium tetrathiomolybdate, or liver transplantation. So this is about copper poisoning. So there are 10 MCQs that can be asked from this topic. So thank you. Happy reading. Hello everyone. Welcome to FMT Guru. Today's topic is thallium poisoning. It's very commonly asked in NEET PG exam, INI-CET exam. Okay. Thallium poisoning. Thallium, basically thallium sulfate, that is known as poisoner's poison. Poisoner's poison. It is a ideal homicidal agent because it is a colorless, tasteless, odorless compound. We can mix with any food and drink, and it has a wide range of clinical symptoms. The one very famous case, Aunt Tally case, in that accused, the culprit was Caroline Grills. She killed 4 persons by mixing thallium with a T and K, and she was convicted later. Thallium poison, it is an insecticide. It is basically a rat poison. Insecticide. It is also in fireworks, metal alloy industries, and it was used in treatment of tuberculosis. Very interesting. Syphilis, gonorrhea, and it is a well-known rat poison. Poisonous poison. What is the fatal dosage? Look at the fatal dosage. It is very small, 6 to 40 milligram per kg body weight. That means around say a 60 kg man, around 360 mg that can cause death. And the fatal period 24 to 26 hours. So it can be acute poison or chronic poison. Mechanism. Thallium that displaces potassium in the very important enzymes of Krebs cycle and oxidative phosphorylation, especially potassium adenosine triphosphatase. You can see in the picture there is a colorless compound, tasteless compound, odorless compound, which is nothing but thallium sulfate, poisoner's poison. Let's see what are the four important clinical features. So with the help of the images. So look at the patient. So there is one important finding. This important finding is nothing but alopecia. Alopecia total that is seen in case of 30 days. It is a most common clinical feature in a chronic thallium poison. One more very important feature in acute and chronic, that is abdominal pain. So this is abdominal pain. And one more very important feature in case of thallium poisoning, that is peripheral neuropathy. There is a peripheral neuropathy, and the neuropathy that is well known as walking on hot coals. That's seen in 2 to 5 days. Painful ascending peripheral neuropathy. And one more picture you can see here. Many are surprised to see that Meese line. Meese line can be seen in thallium poison as well as arsenic poison. The differential diagnosis is arsenic poison. So that is seen around 2 to 4 weeks. Lastly, the very important question asked in exam, treatment. The treatment, the drug of choice must be Prussian blue. Okay, Prussian blue, that is the treatment of choice. That's around 125 mg per kg body weight. That is given BD orally. That is nothing but potassium ferric hexacyanoferrate. And in neuropathic pain, you can give anticonvulsant, antidepressant, and opiates. And hemodialysis is also useful up to some extent. So that's it about thallium poison, that is also known as poisonous poison. Thank you. So welcome to FMT Guru. We are going to discuss barium poisoning in 2 minutes. It is recently asked in NEET PG exam. Barium is a well-known rat poison. The 3 compounds commonly used are barium chloride, barium carbonate, barium hydroxide, and the fatal dosage of barium carbonate is 70 mg per kg body weight. You can see here barium chloride and also barium carbonate. Both are usually white color compounds. They are used as a rat poisons. What are the important clinical features? The fatal dosage is 1 gram. The fatal period is around 12 hours. What are the clinical features? The very important clinical feature is hypokalemia. Hypokalemia leads to barium induced paralysis. You can see here barium induced hypokalemia and paralysis within 2 hours. And normal potassium level is 3.5 to 5.5 milliequivalents per liter. So the treatment given here is potassium administration. And also barium that lead to fatigue, vomiting, diarrhea, lactic acidosis, ventricular arrhythmia, and respiratory paralysis. And the treatment, lastly, treatment is gastric lavage, potassium infusion, sodium sulfate or magnesium sulfate. Lastly, assisted ventilation to prevent respiratory paralysis. This is about well-known rat poison, barium poison. Thank you. Hello everyone, welcome to FMT Guru. We are going to discuss cadmium poisoning in 2 minutes. In cadmium poisoning, please remember two important keywords. One is ailing bones and the second one is falling kidneys. Ailing bones, that means osteomalacia and fractures. Falling kidney, that is nephrotoxicity. Cadmium poison or cadmium is the causative agent in a very famous disease, INI-CET disease. It is also known as ouch disease. It is because of the pain. What are the four common sources? You can see the four important images there. The first one in jewelry making. The second one, it is common in smokers. The one more common source is the cadmium containing batteries. And lastly, shellfishes. Let's discuss about clinical features. So cadmium, what are the sources we discussed? Welding, electroplating, jewelry making, nickel cadmium batteries, smokers and shellfish. The mechanism, the substitution of cadmium in place of zinc, that leads to weak bones, that leads to osteomalacia and the fractures. It causes programmed cell death. There is a formation of cadmium metallothionein complex that leads to nephrotoxicity and kidney failure. The clinical feature, four important clinical features. The one is osteomalacia, second one is abdominal pain, neuropathy, the lastly that is acute interstitial pneumonitis and the metal fume fever. The treatment in acute poison, you can use calcium EDTA or you can use DMSA, that is orally, and calcium EDTA intramuscularly, 75 mg per kg body weight per 24 hours. In chronic, no chelation therapy is helpful and ball is contraindicated in case of cadmium poisoning. Thank you.